Coming together to fight a pandemic, the World Health Organization has launched a global action plan to develop vaccines and drugs for COVID-19. But the US is not taking part. So how do we make sure everyone has equal access to treatment? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. It's been called a landmark collaboration. The World Health Organization, heads of government and research bodies came together to coordinate the fight against COVID-19. They've pledged to work together to find a vaccine and make sure everyone has equal access to treatments and diagnostic tests. But the United States isn't taking part. President Donald Trump has accused the WHO of mishandling the crisis. We'll bring in our guests in a moment to discuss the challenges ahead. First, this report from our diplomatic editor, James Bays.
It's just the place you would have expected in previous times to have seen US leadership. A global crisis and world leaders coming together with a response. The idea of this event to coordinate the search for a vaccine, testing and treatments for COVID-19 and to make sure all are widely available.
The world needs these tools and it needs them fast. Past experience has taught us that even when tools are available, they have not been equally available to all. We cannot allow that to happen.
A world free of COVID-19 requires the most massive public health effort in history. Data must be shared, production capacity prepared, resources mobilized, communities engaged, and politics set aside. I know we can do it. I know we can put people first.
Leaders spoke from all regions of the world. Technically, bringing them all together was a bit of a challenge.
Your Excellency, you have the floor.
Can you hear me now?
Yes, we can hear you.
Okay.
Germany, one of 4 members of the G7 group of countries that were represented.
We're now going to continue to mobilise all countries of the G7 and the G20 for them to back this initiative. I hope that we will be able to reconcile this initiative with China and the US, because the fight against COVID-19 is a common good for humanity. There shouldn't be any divisions between countries. We need to join forces to win this battle.
The fact that the World Health Organization was the host of the event explains why the US didn't take part. President Trump cut all new funding to the WHO because he claimed the global health body had not been tough enough on China.
The WHO failed in this basic duty and must be held accountable.
A spokesperson for the US mission to the UN in Geneva, where the WHO is based, told Al Jazeera there'll be no US official participation. Following this event, the next phase will be led by the European Union. In 10 days' time, they'll be trying to raise $8 billion to make sure that vaccines, testing and treatment are available to everyone. James Bays, Al Jazeera at the United Nations.
Let's bring in our guests. From Grindelwald in Switzerland, we have Dr. Annelies Wilder-Smith, a professor of emerging infectious diseases at the London School of Hygiene and Tropical Medicine. In Oxford in the UK, we have Ian Goldin, a professor of globalisation and development at Oxford University and the author of The Butterfly Defect, that in 2014 predicted a global pandemic was inevitable and would lead to great economic costs. And in Boston, the United States, Dr. Joia Mukherjee, she's Chief Medical Officer of Partners in Health and Associate Professor of Global Health and Social Medicine at Harvard Medical School. Thank you all for joining us. Annelies, first of all, how do you come together and streamline the race to find a vaccine and treatments for COVID-19?
We cannot do it alone. We need to combine the forces, the talents, and the resources to work together to accelerate the development of a vaccine. It will be challenging. We need to speed up We need to be fast, but we also need to be mindful of safety. So we need to come together. It needs to be a coordinated approach, a well-funded approach.
And Joia, what can researchers in the developing world bring to this? Or do they risk being ignored and funding instead being funneled to Europe, to South Korea, to China?
That's such a great question. And I think one thing that we've seen is that there is amazing scientific talent in the Global South. Was talking just yesterday with my colleagues from Rwanda. They have many, many convalescent cases already and are thinking about how to look at convalescent plasma there. Some of the countries in the Global South are far more prepared to do good prevention. So this will give them a leg up on some of the work that will need to be done. So I think there's a lot of great talent.
But Ian, it's going to be difficult, isn't it, for countries like in Europe and the US to resist the urge to look after their own first. We've already had the US and EU putting curbs on the export of protective equipment, for example. Could this be extended to vaccines as well, for example?
I think this is a big worry, and it's absolutely one that needs to be resisted at all costs, because clearly a pandemic anywhere affects all of us. And you can be in the richest country, but no wall will be high enough to protect you from this. So it is, I think, a risk. And that's why those that are manufacturing the vaccines, those that are developing them, need to absolutely insist that these are global public goods and that they roll out everywhere to those in need.
Annelies, a vaccine like this has never been proven at this speed before or produced at the scale that will be needed before. Are we being a little bit too ambitious?
We have to be ambitious. I mean, COVID is now a humanitarian crisis. We need to speed up, we need to scale up, and we need to do this together. And yes, we have to have check and balances in place. We cannot do rushed science. We owe the world good science. But if we do it together and we go not just sequentially, but really also in parallel with various efforts, with the diversity needed, then I think we'll have a product faster.
Joia, is it an ambitious target, this, to try and race against the clock?
It's a very ambitious target, but as my colleague is saying, we have to do it. This is an unprecedented time, although we knew that a pandemic was brewing. And I think we need to, as civil society, as scientists, as journalists, we need to demand that this is done in the public commons as a public good, that this is not about profit. I think profit is part of what's getting us to this massive level of inequality. So I think our solution has to be to fight some of these market type of approaches, because that will not get us to equality. And as we see in the United States, the massive inequality and the fragmentation of the health system that we have had increasingly over the last 40 years has made us the epicenter of the epidemic. And so we have to challenge, at the same time we look to science, we also have to challenge the social systems of distribution, because we know that if we leave it as the status quo, it will result in a cataclysm.
Ian, I see you nodding away a little bit there. Are we being too ambitious, setting too ambitious goals for ourselves, working within the system that the world economy works in at the moment?
It is extremely ambitious. This is, I think, the most ambitious thing that we've done as humanity together. We have to succeed, and we have to succeed everywhere. And if we can succeed with this, I believe we would have learned to cooperate, and therefore I'd be much more optimistic that we'd be able to deal with poverty generally, with climate change, with the other great challenges we face. But it's going to have to be led as a global public initiative by the WHO and others, with pharmaceutical companies and others following their lead and sharing the information. And we're going to need a rollout globally, not only of the vaccines, but the finance that goes with it, the restoration of societies which have been massively devastated, which is unprecedented. This is like after the Second World War. It's going to need a global Marshall Plan, and it's going to need new institutions and more effective institutions to do that globally.
Annelies, I want to ask you quickly about the Zika plan that you've been involved in, which is this attempt to bring a coordinated approach to tackling the outbreak in Latin America. Has that been working? And could something similar work on a grander scale for COVID-19?
So the Zika outbreak really stimulated also a very rapid vaccine development, and with 45 candidates immediately were assessed and then went into human trials. But as we then know, the Zika epidemic abated, and so basically to date we still do not have a Zika vaccine. Just due to the mere fact that we are not able to do a phase 3 trial at a time when there are no more cases globally. For COVID, I think it's different. COVID will be with us. It is not going to go away. But also for COVID, we may have problems in the phase 3 trial because the epidemic is moving quickly. And so setting up a phase 3 trial will be challenging, and it does need the global coordination to do so.
Joia, at the moment, don't we have nations working against each other? They all seem to be in a sort of a race to find a vaccine. They want to be first. They want the prestige of being first. How are we going to change that?
Yeah, I think, and this is where I think the example that I think is important is the action of civil society globally to roll out antiretroviral medicines as a public good. The creation of the Global Fund to fight AIDS, TB, and malaria, the sort of protest that this technology of the triple therapy should be available to everyone. When that work started in the early 2000s, there were fewer than 50,000 people on antiretroviral therapy in Africa. Today, there are 22 million around the world. Now, we need something at a much more rapid scale. But I think the mechanisms for solidarity and global participation are there. Flexibilities in the World Trade Organization treaties. I think we've got to really rethink what these public health crises mean to us as a global society. And I think there's some blueprint for that in some of the activist movements that have allowed us to scale up HIV. And I think we need more of that collaboration and solidarity.
Ian, nations are working against each other at the moment, aren't they, in the race to find a vaccine? They want to be first. They want the prestige. They don't seem to be that keen on collaboration.
Well, I think the scientists are collaborating, and there's been the most amazing sharing of the genomes. There's been real collaboration amongst scientists globally, from China and including the US now. It's the governments and the public policy people who've really been antagonistic. And of course, the US turning its back on the world at this crucial time as a government has not helped at all, because the last thing you want is tensions between the great powers. China's going to have to be part of a solution with the US if there's going to be a global rollout of vaccines. And of course, Europe has a critical role to play in that as well as institutions like the Gates Foundation and so many others. So the politics can be toxic, but I think we've really got to insist that this goes beyond politics. This is not about politics. This is all of our lives that are at stake and the future for all of us.
Annelies, at the moment, help us again to understand a little bit the science of this. Is work being repeated around the world? Are people sharing information as much as they should, or is there more of a race to be first with different treatments or vaccines?
Some competition is healthy, and competition will speed up the development. So I'm not against competition. It has to be that the challenge of competition is later in an equitable deployment. So currently there are at least 90 candidates in development, in preclinical development, and 6 vaccines are now in clinical phase 1 trials. So they have been given to humans, and they use some use similar platforms, some use different platforms. We need to remember this is a high-risk endeavor. Some vaccines will fail, and some vaccines will succeed. We have to stay diverse. We just have to invest in diversity, even if there's some duplication. And some of these vaccines that are currently in that race will be successful. But also remember, we do want more than one vaccine. We need more. And the reason why we need more than one is the scaling up. No single vaccine we will not be able to scale up and manufacture to the needs of the population with one single vaccine. So it's good to have competition, but it's wise to keep the competition under control so that we need to coordinate some of this so that we're all aligned towards the same goal, and that is an equitable access and a scaling up of delivery.
Ian, when you were writing back in 2014 about the threat of another global pandemic, you then wrote how new ways of working are required through the establishment of creative coalitions of government. But when coronavirus outbreak started, it was really every man for himself. European countries notably went all their own way and ignored EU pleas for a collective approach. Are governments likely to be as collaborative in the search for a vaccine as you suggested they needed to be those years ago?
Well, I think this comes at a terrible time in geopolitics. The US and China were already in a friction before this, and Europe had all sorts of tensions within it as well. So it's not a good time, very different to the 2008 financial crisis where George W. Bush picked up the phone to the Chinese and other leaders to get a global solution, and China helped more than any country in the world at that point. So this is a different time. My sense is that we need to work through that and overcome the resistance of certain governments. I think Europe has got itself together a little bit late, but it is now building that capability. And we heard it in the statements from the president of Europe yesterday. And what we will see is those that are prepared to work together creatively do so. Within the US, it might not be the federal government, but the CDC, the Center for Disease Control, and others will come to participate. And my hope is that eventually governments will be dragged to the table. But we can't allow the reluctance of certain governments, however big they are, to stop this endeavor. It's far too important for that. So yes, we do need more urgently than ever creative coalitions. Governments that will do things, pharmaceutical companies, academics, civil society have to work together.
Joia, this is something where once upon a time the world might have looked to the US for leadership. Are we missing it?
Oh my gosh. I mean, I feel so deeply ashamed at the lack of appreciation of science. And one of the things I would say is to echo what Ian was saying about, the worst time. This is right-wing movements around the world have really dismissed science. And we are in a kind of post-reason environment in many countries that used to serve with some, at least, intellectual architecture. And this is what's, I think, most frightening. And this is a reason I'm more hopeful about the global South. My colleagues around Africa, they believe in science and their leadership believes in science. And so I think the dismissal of different work, different kinds of treatment. I think we have to look to strong civil societies and leaderships that believe in science and reason. And then the other thing is, I think whatever we do, equity of distribution, whether it's a vaccine, medicines, PPE, has to be part of the global architecture. And I think Dr. Tedros has been an exceptional leader in that way, really trying to shine a light on the countries that stand the most to suffer from this. And so I think we need to look to civil society, we need to look to science, and really reject this very right-wing anti-science rhetoric that's coming out of a lot of governments, including mine.
Annelies, is that something you've found yourself working up against, the challenge of trying to persuade people to accept the science?
No, the infodemic, the fake news, the conspiracy theories, the sentiment against science that have so impaired the response to COVID, and we are partly to be blamed for the slowness of our response. I think this is a wake-up call, more than ever, that science should drive our response to public health and not politics. And so I think the movement yesterday with the WHO launch of this unprecedented partnership is very important. And I think the message or the words that Jeremy Farrar said in the end was, together we can, together we will, and together we must. We must give hope to our populations. People are anxious. Economies are falling apart. We just need to hold on to science now more than ever.
Ian, there's no real leverage that the developing world will have in all of this, is there? If it's the UK, the EU or the US spending tens of billions of dollars on the research, and they're going to get the benefits first, aren't they?
I think the leverage is the fact of these systemic risks. That a pandemic now and the solving of this pandemic requires that all countries in the world solve it. Otherwise, it hasn't gone away. And stopping the next pandemic, which could be, although it's horrible to think that, even worse than this one, requires that all countries in the world have decent health systems, have the capability to defend their citizens against pandemics, and that we stop them spreading globally. So I think now more than ever, there's been a demonstration that no country can be an island, no region in the world, no matter how rich, is going to be able to defend itself, and that this is either solved for all of us or for none of us. And if people haven't woken up to that fact in the rich countries, they really don't understand what causes pandemics. So I'm optimistic that this will really be a wake-up call and teach governments and individuals, citizens around the world, that we need to work together, that we are only as strong in humanity as our weakest links.
Joia, when new treatments or vaccines emerge, and they're going to be initially, supplies are going to be limited, who's going to get it first? Is it health workers? Is it countries with active outbreaks? Is it infection hotspots? Is it those with the fattest wallets?
It's fattest wallets. And I think, while I agree with everything that Ian is saying and Annelies is saying about, we have to think about all pandemics affecting all of us, the sad reality is they don't affect all of us equally, as we all know. And what I'm worried also is about famine and the knock-on effects of this in very poor countries like India, like Malawi, and the slowdown of the global economy. So I think it has to be more than just to say all pandemics affect all of us, but somehow the building of international coalitions of solidarity to say equity and fairness has to prevail. And I think this is what I'm most worried about is the global economy that slows down here in the United States is terrible, and there are many jobless people. But we are going to see famine in places like Yemen, and places like India, and places like Haiti. And I think we've got to think about another kind of civil society architecture that says somehow we are all standing together, because we're going to need more than the vaccine, more than the medical part. We're going to need a massive social uplift of people around the world who are so vulnerable. And I don't see that happening without a very strong movement.
Annelies, where do these new treatments and vaccines need to go first?
Where the current hotspots are, and the hotspots are changing, as we know. So it does come like a rolling tsunami and seems to affect different people, different countries at different stages. Yes, that's where they need to go. Of course, healthcare workers are the first group that would need to receive the vaccine, and all the vulnerable populations. Over.
And lastly, with you then, Ian, when these innovations appear, how difficult is it going to make sure that they're delivered fairly, rather than, as Joia was saying, to those with the fattest wallets?
I think Joe is absolutely right. What this pandemic has revealed within our countries is how the stark inequalities in health provision, who's affected most is the poorest, not only in terms of the health impact, but also economically. They don't have savings, they're laid out of work. And this is going to be true within countries as it is between countries. So this is going to be devastating for development. We need a massive, I've estimated $2.5 trillion plan globally to help countries that are overwhelmed by this economically as well as medically. In terms of how this is going to have to roll out with vaccines, my view is that we're going to have to insist that the global institutions like the WHO, like those that are developing the vaccines, distribute them equitably according to need. It's going to need a massive, I think, revamping up of many pharmaceutical companies, instructing them, giving procurement to those that are prepared to do this. And I think we as societies, including civil society everywhere, are going to have to insist, as happened with HIV/AIDS, that this happens.
OK, we are unfortunately out of time for the moment, but thank you very much for your insights to all of our guests, to Dr. Annelies Wilder-Smith, to Professor Ian Goldin and to Dr. Joia Mukherjee. And thank you, too, for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Bernard Smith, and the entire team here in Doha, bye for now.